Hi, my name is Sinthujan Singhalian, and I'm here today with my co-presenter, Priyanka Chawla, to talk about ethics in AI in healthcare, and to discuss some of the many conversations around this topic. So to begin things, let's begin with the development and advancement of electronic health records, or otherwise known as EMR systems. EMR systems are undergoing a rapid transformation in many countries as they replace older models of recording patient information, such as charts, or fragmented electronic systems that used to act as patient info storage centers. These new systems, such as Epic, Cerner, are able to house the entire patient record into a single medical record number and make it accessible to all healthcare providers in the circle of care for the patients. So what are the benefits of these EMR systems? They are amazing data repositories. They carry information in both structured and unstructured form that can be easily encoded so that machine learning models can learn from them. They have enhanced privacy and security, and they provide greater accountability and ownership of the medical practice and decisions due to the features that they carry within the system that's able to track who is doing what. These are all cornerstones when thinking about ethics in healthcare. But some questions to ask is, are we making sure we're collecting our data in an ethical manner? Are we focusing on privacy? Are we ensuring accountability of all inputs that are being entered? And are we ensuring that the information is accessible to the right people? In my opinion, EMRs do a very good job at delivering all of that. So what are the practical implications of what I like to call smart EHR systems? Well, we can see this information being used in so many different applications. Let me try to list a few of them. If you look at NYU Langone Health's predictive analytics department, they mine EMR data and have created some amazing tools, such as predicting patients' risk for sepsis in the emergency room. You can see the Hospital for Sick Children looking at using data repositories of patient images to differentiate and classify different diseases to optimize referral times so that patients don't suffer from erroneous harm. So you can already see that clinicians and researchers are leveraging the data from these EHR systems or EMR systems to help push forward the two cornerstones of ethics in healthcare: beneficence and non-maleficence. So let's go into some concepts that we should be aware of when dealing with ethics in healthcare. Algorithmic bias and awareness. I think the best place to understand algorithmic bias is by watching Coded Bias. This is a documentary film directed by Shalini Khandeya, featuring the work of Joy Buolamwini and other prolific researchers. These researchers are investigating the world of algorithmic bias and fairness as it relates to the term artificial intelligence. The film begins with Joy's initial observation of racial bias in a computer vision application that is unable to recognize her face, the one of a Black woman, but is able to recognize a white synthetic mask. Now, you might just think that these technological innovations are flawed or primitive or haven't been developed rigorously enough. But in actuality, they're just built to prioritize certain demographics over others. The computer vision application actually recognizes a white face, even if it was made from polyester, but does not understand people with various skin tones because that isn't compatible with the worldview it was built on, aka the data sets that were used to build it. Now, drawing from this, Joy begins to explore real-world examples of the interconnected world of algorithms claiming to build a utopian society, one that appears to be infallible and free from bias, but silently really reinforces systemic and structural modes of oppression. So that begins the conversation. It's imperative that the data sets that we use to train models, especially in healthcare, are representative of all populations and deliver the same clinical outcomes to all populations. Next concept is security and data privacy. In healthcare, privacy is integral. Patient information confidentiality is a tenet of the profession, and anyone working in the healthcare sector needs to educate themselves on patient confidentiality and privacy. Let me tell you about a concept called the Big Nine. The Big Nine is a concept established by Amy Webb that identifies 9 global conglomerates shaping the tech world. I'm sure we know some of their names: Meta, Apple, Google, Amazon, etc. These companies are spearheading some of the biggest innovations in AI and really defining the field as we see it today. Blake Murdoch, a researcher, published a paper recently, and that basically highlights the benefits of hospitals and academic centers partnering with these corporations. So essentially, we call this the public-private partnership. Private corporations leverage the data that hospitals have been collecting for decades and helps them think of new innovation and new products to create. Hospitals benefit from getting the resources that private corporations are able to afford, such as more cloud space, more computational power, more staff, more resources, to help further their own research agenda to improve healthcare in patient populations. However, we must be careful to ensure patient privacy is managed always. Some ways to help promote this is to ensure any data that is being fed into models are maintained at aggregate level as best as you can, as well as to ensure that data never physically leaves the hospital environment. Best practice would be to have a centralized project-specific data storage center at the academic research hospital. This storage center would be Research Ethics Board approved for certain projects, and it ensures that they remain solely on the hospital servers. Data breaches usually happen when data is being freely flowing between institutions and corporations. It's best to bring the resources to the institutions and rather have the data go everywhere. The next concept is community health. Community health is defined in health services as the protection and improvement of the health status of population groups and communities. When it comes to ethical AI, I advocate for a more participatory role of community members determining the technology that will influence the care that they receive. Increased health literacy promotes better health outcomes. This has been proven in the literature time after time. Currently, we are developing models with the potential to augment clinical care and be used to treat and screen patients. Yet our patients have no idea on the inner workings of these systems. Conveying awareness and understanding of the interventions used on patients are very important for researchers to think. It also gives them the opportunity to get feedback early on in the research process, almost following an iterative design that we see in the tech world, in which experiments in this model can be improved based on community feedback. Finally, accountability and operational use of AI. EMR systems do a fabulous job at recording accountability, and in some cases, they help streamline operations and help optimize the workday for healthcare professionals. They do have their pros and cons, but ultimately having a centralized, seamless patient record is of great benefit to healthcare providers. However, when thinking of deploying EMR systems and tech-based innovations, it is important for healthcare administrators to think of the implication this might have on the labor force. Human talent and innovation should never be stifled or replaced by autonomous machines. I hold the view that it is immoral to justify the replacement of human labor for machine. In fact, I believe the right thing to do ethically is to understand that machine and these tech innovations can help further one of the sustainable development goals, that decent work and economic growth for people. Replacing autonomous tasks and mundane duties can really help people tap into their innovation and creative side to think of new solutions and workflows. We are so burdened in our day-to-day jobs by administrative duties, and having a machine complete that for us will help us contribute our talent in different ways to organizations and society. And corporations need to understand that human life mustn't be replaced for machines, but rather machines should be there to act as an aid to foster even greater human talent and creativity. So it's really important to have ethical frameworks and to think about ways early on in the stage, but I believe in end-to-end solutions. And that begins first by education. Having curriculums for healthcare professionals during clinical education on the usage of EHRs, how to use them properly, and how to maximize on their benefits. I also believe in building stronger relationships with community and healthcare organizations to ensure retrospective health data is reflective of the population it's serving. I also believe in creating tools to make health records more accessible to patients so that they have an idea of what providers are writing about them, and so that they have more of a say in their own healthcare journey. And finally, I also believe in designing provider-oriented EMR systems. I believe in this new world of healthcare, we are focused on being very patient-centric, which is great and very important, as the patient should be the central focus of healthcare systems, of designing healthcare systems. But it's also important to think about the considerations and feelings of the people delivering the healthcare. Healthcare providers such as physicians, nurses, allied health professionals offer a great benefit. And to make tools also geared towards optimizing their day-to-day workflow will help with retainment and would also help with creating a better work-life balance for them. And with that, I pass it on to my co-presenter, Priyanka.
From tracking disease outbreaks to workflow optimization to mobile apps developed to monitor and track patient health status, artificial intelligence can help reduce some very difficult problems faced in the healthcare industry. However, when these systems are not developed and implemented carefully, they can do more harm than good. Environmental circumstances can lead to poor access to health, which leads to poor health outcomes. All of this infiltrates into the data and causes biases in decision-making. With AI, these problems can have an exponential impact on the population. So how do we solve these very wicked and very complex problems that plague the healthcare data system today? Before we dive deeper into frameworks, consider the African philosophy of Ubuntu. According to Cebellos Framework, Ubuntu philosophy states that humans are interconnected and there must be a process of cooperation and collaboration to create and maintain social harmony. As we proceed, think about the ways this philosophy is applied in frameworks or can be applied in AI's application in healthcare. Within the context of Ubuntu's philosophy, Cebellos has created a framework. In particular, pay close attention to the third facet of the framework and think back to the early reports of COVID-19 cases coming out of countries like the United States. In the United States, it was discovered or concluded that Latinx and African Americans have been affected by the disease at a higher rate than others. This causative conclusion is not due to an inherent susceptibility of acquiring COVID-19 in these populations, but rather due to long-standing discrimination that has contributed to poorer baseline health and reduced access to care. If your dataset is trained on biased data and pre-existing inequities are not accounted for, then AI will do more damage to marginalized community, as the conclusions would not be context-dependent and extremely discriminatory. Although there are some challenges with studying populations and tracking diseases in large populations, there are also certain benefits. For example, let's look at the COVID-19 outbreak in a Toronto startup, Blue Dot. On December 30th, 2019, Blue Dot's AI technology picked up a cluster of unusual pneumonia cases in Wuhan and reported these findings to the Canadian government. Blue Dot's predictive ability comes from the data it collects outside of the official healthcare sources. This includes worldwide movements of more than 4 billion travelers on commercial flights every year, as well as humans, animals, and insect population data. In addition to this, climate data is also collected from satellites and local information from journalists and healthcare workers, as well as 100,000 online articles released each day that span across 65 different languages are also included. The engineers have manually classified this data and developed a taxonomy so only relevant keywords could be scanned efficiently. Now, this is an example of how using data outside of the healthcare resources can still provide some useful considerations and conclusions that can be applied for disease tracking and meet some of the ethical framework requirements that we'll be discussing next. The impact of using unbiased data or biased data is described by this diagram, where we see the role of environmental factors, or the world, its effect on the data, the design derived from the data, and the eventual use of the algorithm, which again in turn affects the world we live in. For example, as stated in this paper, health inequalities that exist today seep deep into the data. These form the biases of the data used to train the algorithm. Additionally, data from underserved communities is often excluded as many of them don't have access to healthcare. This exclusion eventually results in the data not being completely representative of vulnerable populations. And undersampling of vulnerable populations gives rise to biases, which again get ingrained, leading to biased judgment in decision-making, public health monitoring, and other forms of AI application tools. Now, you may say that unbiased data collection is not possible today because there is an increase in use of digital tech like smartphones for health monitoring and tracking. But an ethicist will disagree. Not everyone that has a digital smartphone possesses the digital literacy skills or digital health literacy skills to operate the phone and input their data. As well, some people may not even own a smartphone. So using data from digital tech apps can pose very similar risks for underrepresentation and biases. We then explored so what frameworks can be applied. We turned to literature to review some articles that were released on ethics and AI and its application in healthcare. And we found 3 papers in literature that provide frameworks for the application of AI ethically in healthcare. The first paper surveyed how AI ethics frameworks have been implemented and evaluated in healthcare applications. It also maps the scope, challenges, and practices of these initiatives. As well, the scoping review aimed to examine the implementation of ethics framework in AI applications in healthcare. They essentially had the 4 questions that are presented on the screen. Let's review some of their findings. In literature, the 4 ethical principles, autonomy, non-maleficence, beneficence, and fairness, have been classified as bioethics principle. During their scan, non-maleficence was found to be the one principle that was considered the most. In terms of challenges at the ethics principle level, well, there can be some odds. Now, what do I mean by this? Let's consider a clinical decision support system, or CDSS. In a CDSS, beneficence can compromise autonomy because of the lack of understanding of how decisions are made, or managing biases in datasets can oppose justice and non-maleficence. Fairness in machine language was found to be multidimensional and can be attained by optimizing equality of outcomes, accuracy, and allocation of resources for each group. Additionally, the ranking of importance in terms of principle also varies and is context dependent. For example, as a caregiver, you would prioritize safety over privacy, whereas as a patient, you would prefer to preserve your privacy. At an organizational level, the review found that competing interests and disparate backgrounds ranging from clinicians, developers, legal counselors, and board members can make implementation very difficult. For example, a developer may tend to reduce ethics to fairness, and this may cause tensions with clinicians who may have a broader scope for ethics. In research facilities, funding constraints can also make multidisciplinary collaboration difficult. So these were some of the challenges. Well, what about some strategies that were helpful in implementing an ethics framework in healthcare? Well, this particular paper found that being proactive and considering ethics at the design and user requirement stage was extremely helpful. Additionally, having a deep understanding of the context of the environment and embedding principles of ethics in the algorithm and data collection was also found to be extremely helpful. Lastly, upon evaluating the implementations of ethical frameworks, efficacy, privacy, autonomy, and use of relevant settings and trust being maintained were some very important considerations. Another framework that has provided some light on the 6 domains where big data is currently employed in healthcare and research by Science, Health, Policy Relevant Ethics in Singapore. Now, this framework is not exhaustive, but it includes 16 values and highlights 3 general issues that are common across all decision-making in big data context. These include respect for persons, social license, and vulnerability and power. The framework was also created based on some very common challenges faced in the healthcare industries. This includes openness in big data and data repository, precision medicine and big data, real-world data to generate evidence about healthcare interventions, AI-assisted decision-making in healthcare, public-private partnerships in healthcare, and research and cross-sectoral big data. This framework was developed to primarily focus on some of the management challenges, such as operational and ownership issues, but other challenges related to process, such as interpreting big data, as well as issues on data challenges, such as capturing and integrating information. Another issue that often arises with healthcare data is anonymization, which is a highly technical process, and the risk of re-identification is very high. So this particular framework breaks down key ethical values and encompasses 9 substantive values. By substantive, the framework points to considerations that should be realized through the outcome of a decision, and 7 procedural values that can guide the process of deliberation and decision-making itself. For example, maintaining transparency can help promote the substantive value of justice by enabling scrutiny from third parties who are able to point out any discrepancies. The values listed on the slides are very general, and they need to be as they cut through multiple domains of big data and provide ethical guidance on how key stakeholders in big data can think through these challenges to come to a decision in a number of domains where big data is used or shared in healthcare. Another review conducted by Floridi and Cowles represents these 5 principles, which form an ethical framework that can be applied in AI in healthcare. So you might have seen the first 4 before, but something like explicability is an added principle that incorporates intelligibility, so answering a question such as, how does this particular technology work? As well as accountability. So a question like, who is responsible for the way it works? Essentially, for AI to be beneficent and non-maleficent, one must understand the good or the harm it can cause to the society, and in how many and which ways. In addition, to know how AI would act, and for AI to be just, one must know who should be held accountable if there is a negative outcome. So this brings us to the end of the framework. And with that, we'd like to conclude by saying thank you for listening to our presentation, and please let us know if you have any questions.